Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Kunney.
Hello, everyone. This is Christopher Kunney, and welcome back to another episode of Straight Outta Health IT. I am so excited to have on the program an amazing expert in an emerging field that's happening right now. Everyone's talking about artificial intelligence, AI, generative AI, ChatGPT, you name it. This whole conversation about how AI is going to affect our lives, and especially in healthcare as well, is a very relevant and timely conversation. So we're going to jump into a discussion about this and hopefully stimulate some thought on your end, as well as enlighten you on some of the things that are happening in this space. So AI itself has come really a long way in recent years. It's been a game changer, and it has also impacted healthcare. Its impact on healthcare has actually been no short of revolutionary. One of the most exciting areas of AI in healthcare is generative AI, which is basically a technology that uses algorithms to create data and insights. It's a great way, or it's starting to become a great way for clinicians to start using the insights from these technologies to diagnose diseases and treat patients, understand how to provide personalized medicine, and help drive drug discoveries. But also, AI has some concerns as well, too, for the marketplace. We're going to delve into some of that in greater detail and really talk about some of the promises, some of the implications, and some of the concerns around how AI can make our lives better and impact our lives potentially in both a positive and maybe not so great of a way as well, too. So we'll jump right into that. And today on the program, I have an amazing expert. Her name is Kath Dalton Ford, and she's the Chief Product and Strategy Officer at Ronin, which uses AI to collect and correlate and contextualize data to support efficient, confident cancer treatment decisions at the point of care. In her role with Ronin, Ms. Ford oversees the ideation and commercialization of solutions to the market and oversees strategy and consumer success for the operations. She also volunteers as an advisor on the Health Foundation C-Suite program, where other healthcare industry veterans selected Ms. Ford to offer guidance on business growth, professional growth for members within the healthcare industry. Previously, Ms. Ford was President and Chief Product Officer for Rhinogram, a leading cloud-based HIPAA-compliant virtual care platform. In this role, she was instrumental in driving the company's exponential growth over her 3+ years there. Before Rhinogram, Ms. Ford co-founded Jellyfish Health, a first-of-its-kind disruptive patient flow logistics solutions that dramatically improved clinical and operational efficiencies. And then early in her career, she oversaw executive portfolios for organizations such as GE Health, Siemens Medical, McKesson, and Nat Health. She's a member of the Women's Business Leaders of the U.S. Healthcare Industry Foundation, and Ms. Ford's reputation, commitment, and passion for improving the quality of health and patient outcomes is the reason the healthcare industry recognized her as a pioneer in this industry. And most recently, she was recognized by Becker's Hospital Review as one of its 2023 Women in Health IT to Know. She's also received this recognition in 2019 and also in 2022. So who better to have on this program today and talk about this topic than this amazing woman? Welcome, Kathy, to Straight Outta Healthcare IT. It's such a pleasure and honor to have you on the program.
Thank you so much for having me. It is also my honor and absolute delight to be here with you and talk about this very important topic.
Well, great. Well, but before we jump into the topic itself, one of the things I always like to do with my guests is, I read their bios, and you have a very impressive, extensive bio, and I commend you for all the accomplishments that you've done throughout your career. But that's just part of the story, right? It just kind of tells the milestones of your journey. But I think our guests would be really interested in you filling in the blanks and telling us, how did you even get into this industry, in healthcare and healthcare technology, and then your different roles in some very prestigious organizations, and ultimately led to you to what you're doing today. So if you could take just a few minutes and share a little bit about your journey.
Yes. It's actually full circle, really, a journey to our topic today. But for me, really going back, I got into healthcare purely by accident. It was really just marketing opportunity at an ultrasound company a very long time ago, over 30 years ago, which shortly after that, after a few years of doing that, that was my entry into healthcare. Right. I had the opportunity to join another company and implement radiology information systems. So in that role, which I always describe as one of the hardest jobs I've had over the last 30 plus years, I would spend months at a time in a hospital and shadowing clinicians and administrators, to understand workflow and needs and challenges to build a software solution that would ideally be solving problems in order to deliver better care. What I learned out of those years of doing that and those dozens and dozens and dozens of hours sitting with clinicians is that really software was more of a hindrance than a help.
Right.
And that actually there are so many inefficiencies and broken elements of healthcare. And that time, basically observing and kind of living the life in a hospital became the spark for me, like, truly within, to say, I think I can do something here.
Sure, we can make it better, right?
Yes. This cannot be the end all be all.
Exactly.
And again, this was a very long time ago, but it began sort of my passion-driven journey to learn everything about healthcare and the continuum as I possibly could, to really understand what was going to move the needle, if you will, to make the big difference and why. And so, I'm grateful that I got all the best training at some of the biggest global companies like the GE, Siemens, McKesson, and gave me all of this fantastic foundation to then go on and sort of parlay that into more of a builder, driver, innovator sort of set of opportunities and functions. And really, even I say it's full circle because some of the early work I had the great opportunity to be a part of was sort of the early days of AI, what was known as computer-aided diagnostics in imaging. And we were able to identify tumors and suspicious lesions and other elements in imaging way before a radiologist could detect.
Exactly.
And that was very cutting edge. It took a very long time for the industry to adopt and believe.
Right.
But now it is a standard of care, absolutely saving patients' lives all over the world. And so that, along with countless other examples and some of my other children, as I like to call them, still in use today, are why I'm such a huge advocate for leveraging technology in the right way in order to solve some of the most challenging issues in healthcare.
Well, that's great. Well, first of all, I commend you and thank you for your leadership in that space. To your point, in those very early days of adoption of technology in healthcare, many healthcare professionals were very suspicious about the real value add it could bring. Was it going to, in some cases, replace me, or in some cases, do more harm than good? And in those very early stages, sometimes that technology would make their jobs harder as well, too. So for you to kind of persevere and help drive the transformation of these technologies and the advancement of these technologies to a place where they're now acceptable in this space is commendable. So I thank you for your leadership, and I'm sure others too. I'm sure you had a small part of actually saving people's lives. And so we appreciate your leadership there. Now let's jump into the topic, because I think a lot of folks are really curious about this whole concept of generative AI or generative artificial intelligence. And in recent years, this field has witnessed just a revolutionary transformation driven by the advancements of the technologies, as you mentioned in your summary. One of those groundbreaking technologies is just this concept of generative AI. And the term's being used on a lot of different ways and connotations. But at its core, the hope is that it has the potential for transforming the way we diagnose, treat, and manage diseases. So can you, from your view and lens, offer your perspective on just exactly what is generative AI and how do you see it having an impact on this industry going forward?
Yes, it is a very confusing term, I would say, right? Yeah, because it can be applied to write your college essay, and then it's being talked about. And in some cases, there are some early examples of trying to use it in healthcare, but
Exactly.
lots of beliefs and claims. In short, generative AI, an easy way to look at it, I think you also described it nicely in the intro here, is it's when AI is creating content in some form or fashion. We saw a lot of it sort of launch and then really fail at the beginning of COVID to chatbotting.
Mm-hmm.
So it's probably the easiest example for anybody to get their arms around. So you pose some questions and the AI is coming back with answers or content based on your answers. And how are they coming up with those answers? How is AI coming up with those answers? The model is going out and looking at hundreds, if not thousands and thousands of data points in order to correlate that data together and come up with what it believes is the content to serve back. And so to sort of extrapolate that basic example of generative AI into really more complex care settings, clinicians in their day-to-day are asking questions about patient care.
Right.
They're using their own large language model, which is their brain and their personal database, and then also other reference material and such to try to answer those questions based on hundreds of other inputs. And they're trying to do that themselves.
Exactly. And trying to do that real time to some degree as well, too, right?
Absolutely, yes. Yeah. And so you can see, where all of that can break down in so many ways or not be as fully leveraged as possible. Because in healthcare, we're not short on data.
Right.
We have an enormous amount of data around. There are many reasons why, unfortunately, it's not being fully leveraged. But AI, there's promise and hope, and really how Ronin is looking at AI is to leverage way more healthcare data in order to bring those insights to the point of care for a clinician. It's really important from a grounding perspective, especially in cancer care, but in other chronic diseases as well, and patient care scenarios, clinicians are often only able, their only thing available to make a patient treatment decision or answer a question, as I said, about what to do next or what's happening is incredibly limited, and it's generalized. And so if I'm being treated, for example, that clinician doesn't have any kind of tooling to say, what's unique about Kathy that I need to know that maybe I'm not going to choose treatment 1 that is listed in this NCCN guideline book. And because the guidelines are going to give me 25 options. And depending on the cancer type, it could be more than that. Maybe
that's right.
How do I know which one?
That's right. And what's the latest and greatest research and insights that may not have been published in the last periodical or document that clinician read that could have an impact on your care as well?
Exactly. So the drugs are changing literally daily in oncology. It's
absolutely.
It's impossible, in fact, to keep up with. But most importantly, what we all want to get to and what's going to drive way more improved outcomes, it's going to affect the cost of care, some of these 10x pain points in healthcare that we really have to go after. And ideally, all vendors are focusing on things that are 10 times painful, is not what's a general decision approach for my care. What do you know about me? And how are you considering those things about me particularly that you can then derive the best treatment for the best outcome?
Exactly. More precision-based healthcare. Absolutely. Absolutely.
And that really is the promise and the opportunity for AI, is to ingest hundreds, if not thousands of data elements, understand the hundreds of unique, if not even thousands of unique things about the patient, then cohort those things in order to provide a way more precise point of care patient perspective so that the clinician can make the most informed set of decisions and feel that they can trust those decisions.
Exactly. Yeah. So the power of AI is to generate really new insights to generative AI. Anyway, it's not just about consolidating existing information and serving that up in a format that may add some value, but it's also taking that information and coming up with its own insights about that individual, hopefully something that's more precision and more focus based on that individual's condition and really offering the clinician the ability to get access to a vast amount of information about not only that individual, but of the scientific research that's out there, the holistic research that's out there, the social determinants of health, all these different factors that may have a direct impact on an individual's overall physical state, and what are those best options for treating that patient as well, too. And I personally see AI, at least in its initial phases, being more as an advisor to the clinician, not to necessarily replace them, but to provide some sort of additional meaningful insights and recommendations that then they can take based on their education, experience, knowledge about the patient, and hopefully apply it so that they can make better clinical decisions. And also, to some degree, the patient can be more informed as well about the options that are available to them themselves.
100% on both fronts. From Ronin's perspective, there's no replacement of the clinician. There is the opportunity to put forth much smarter tools so that clinician can be way better informed as precisely as possible. It's not our position that an AI piece of technology is going to replace all the values that come from a clinician treating a patient. And
so drill down into that a little bit more specific to Ronin. Here's your opportunity to do an elevator pitch on what you guys do and how you're impacting this as well, too. Talk to us a little bit about Ronin and its application of AI and some of the benefits that you're seeing from the work that you guys are doing.
Yes, thank you. So Ronin, in short, is a clinical decision support tool that serves up insights at the point of care to clinicians to make a more patient-specific set of decisions or, say, insights based on leveraging advanced tooling like AI and machine learning and LP and others. The solution is really made up of sort of three pieces. You mentioned the patient, and really the patient is at the center of all of this. Ronin has built a comprehensive solution stack that's used by clinicians, but it's ultimately all about treating the patient and enabling the clinician and the clinical team and really administrative teams as well to serve the patient in the best possible way. And so Ronin does that by engaging directly with the patient. Patient expectations. Cancer happens to be one of those just crazy diseases that in order to make a patient or try to heal a patient, you have to make them sicker first.
Right.
Through chemo and radiation, other treatment approaches. And often that's incredibly destabilizing to a patient who, would it not be too? And oftentimes patients are not sure whether or not this is expected or not, and then what to do. And we often find patients going to the emergency department when they don't need to be there, but it's because they're unsure, they feel disconnected, they feel scared, they feel sick. When you're already in a compromised immunity situation, we all should avoid ED. Absolutely need to be there.
Exactly.
Especially when your immune system is so compromised to begin with and you're already very sick. And so the patient application part of Ronin is an intelligent system that is staying connected, surveying, and allowing an asynchronous bidirectional communication pathway between the patient and the clinical team.
Right.
But to make sure that they're staying on their treatment, to manage their adverse events or symptoms, and then also to educate them. So we serve up education based on where they are in their treatment, things like that.
Sure.
So this is actually really critical because oftentimes in cancer care, patients will drop off of their treatment because of the adverse events, because they are so unsure or can't get in touch with their care team.
Right.
Then it progresses and then it's more expensive and outcomes, remission opportunities, obviously potentially at risk there.
Exactly.
So that's one piece of Ronin. Second piece is what I would call mission control of you, clinician. So one of the biggest challenges in cancer care is there is so much to understand about a patient as a treating clinician that it often takes, we've seen somewhere between 25 to 45 minutes to dig around in the source of truth, which is work. And you have to understand things like the last lab values, what were the ranges, any surgical notes, What has the patient had any reported symptoms? What does the last path report? And because weeks and weeks and weeks go by between each patient visit, nobody's retaining that, of course, by memory. So you're literally re-educating yourself as a trained clinician.
Exactly.
And these really important data elements are buried. And so what Ronin does is we find them, we clean them up. It sounds so much simpler than it actually is. And we correlate and contextualize it, and then we organize it in a user interface, then providing a clinical user experience that matches the way a clinician actually is needing to understand their patient in the order in which. And so we've taken basically a chart review time that 25 to 30 to 45 minutes down to 5 minutes.
Oh, wow. That's amazing.
Is especially if you're a treating clinician and you see 20 patients a day. And if you
Absolutely.
need the time as a patient, you don't want to be the last patient of the day.
That's right.
Really tempting to be hunting all that data down. But it really shortens that cycle and gives that clinician way more time to do other, more higher value things and to be focused on that patient. So that's sort of a really critical point of care cockpit, if you will, that we serve up. And then the third leg here is on the insight side.
Sure.
Is we take all that data that we have extracted, clean, correlated, and organized, and then we apply it to large language models, and we start looking at cohorting. And now what we are delivering is, for example, we have out today ED insights. So we're at the point of care. We're able to, based on all the current data, so lab values and social determinants and comorbidities and several hundred data inputs essentially, and we're able to tell that clinician at that moment what the risk index is for that patient to visit the emergency department. And through Ronin, so a clinician, think about it in real time, can see that alert, and then through Ronin,
exactly.
Patient. And can you imagine if you proactively got a message to your patient saying, you are at risk based on this, so either it's expected or let's have a visit, or
right, let's intercede and try to avoid that episodic event from happening.
Exactly. And where we're going with as we're evolving our insights is toxicity.
Sure.
So again, with thousands of drugs on the market and new ones coming on the market literally every day, a clinician is looking for black box warnings. They're looking to understand what treatment is my patient on now that there's an issue. So we're going to bring all those insights again at the point of care for the clinician to not have to go digging around, hopefully reading the most current, accurate, and have access to it and put that all together so they can also anticipate toxicity for that patient, which from a patient value perspective also is missing. And this is where Ronin the evolution of Ronin is to continue to evolve and add more questions to answer. The next question that needs to be answered in care is, what does the patient want? Does the patient want to just walk their daughter down the aisle? And that's the patient goal, especially in cancer.
Yeah.
Or I need to work. I can't be sick every day. So I need a treatment regimen that's going to support that life requirement for me.
Exactly.
No tools in place today that give that kind of levering, say, ask multiple complex questions about how to treat this patient and give me some insights.
Right. And meet that patient where they are. And it's so interesting because I'm very passionate about this topic as well, too. My mother, unfortunately, lost her battle with cancer. And I think it was from a host of reasons. One, early detection was clearly one of them, because by the time it was discovered, it had already metastasized and there was not a lot of options for her. Two, the whole care management piece of that, the patient engagement piece, when she started going through chemo and started having those adverse effects related to it, she decided at some point that she was going to stop. And she didn't want to go through with it anymore. She said, I'm just going to let nature take its course. And ultimately, nature did. But to have a technology or tool or resources like this that could have understood her journey, understood what her desires might have been, and what other potential options out there were to prolong her life in a quality way, I think there might have been a completely different outcome for her. And we may have had her longer in our lives than we did because she chose quite honestly, the most aggressive way to end their life, which was to get off of all the treatment and allow the cancer to take its course. And so I'm excited about the potential possibility technologies like this and advancing and improving the patient engagement, the patients understanding what the patient is and what they're looking for in this life journey as well too, and helping to manage that, but also advancing medical research and just transforming the way we deliver care for patients going forward and reducing some of the cognitive workload on the clinician. Having seen those 20 patients a day and getting to the end of the day, are they providing the best care possible? Because they themselves are mentally and physically exhausted. And having tools that can help alleviate some of that pressure, I think is great. I did want to switch gears though a little bit, and I'm excited about all the potential possibilities of AI, but there are also, conversely, concerns. You most recently had leaders from OpenAI and Google DeepMind and others who have recently signed kind of this open letter about mitigating the risk of AI and how AI may have huge negative societal impacts on us as a society, not just on the healthcare side, but obviously in other verticals as well too. And then those of us who are science fiction junkies, we've all seen the movies like The Matrix and you name it, the scores of other ones who talk about how AI will ultimately gain consciousness and take over and decide that we're the virus, right? And we need to get rid of humans in order to maintain the world system in a more constructive and positive way. And I say that tongue in cheek, but I think there are some real implications around AI, just around bias, for example, and the inherent biases that, because it is using data from sources that have, in some cases, inherent biases. So I'm just curious about your thoughts around the governance of AI and the impact that it will have, and how do we mitigate some of those risks?
First off, I want to just extend my condolences for your mother. And
thank you. I appreciate that. It was definitely a challenging journey. It's a whole nother conversation for another day. But I saw the impact of where we are in our healthcare system, and we have a long way to go to improve the quality of life for those who are dealing with these types of illnesses.
And what you saw is the conundrum that healthcare is in,
right?
Which the need to adopt technology faster,
right,
and yet be very cautious and careful. What I'll tell you in regards to the fears and concerns is healthcare, unlike many other regulated industries, and certainly very unlike other industries that are not regulated, has traditionally been and continues to be incredibly risk adverse,
right,
and evidence-based. And those mechanisms, those control mechanisms have been deeply rooted for a very long time, almost to the detriment, I'd say, we're on the borderline of that. And so different than other industries, that will provide some needed sort of forced caution. We also in this country, unlike other countries, have the FDA, and we have a regulation approach to devices and software and tools, which I believe will be important to implement the right level of oversight and accountability responsibility that exists for other things that are in vivo and vitro as a part of care to keep patients as safe as possible. So I think the cautious nature of our industry and the speed in which information is now traveling, unlike a couple of decades ago.
Yes.
World Wide Web and all things internet and sources of data are exponentially.
Right.
And
that's quality data and false data as well, too. Not, unregulated information that seeps into those decision-making processes as well.
Best solutions will have significant evidence to support the competency and the value of the tooling. The best solutions will take the same approach that Ronin is, which is full transparency of our algorithms. What we do, unlike most other providers incorporating AI, is within the point of care, within our application, in the UI, we are showing our full algorithm to the clinician so that they know exactly how we came to our insights and what was used, what wasn't, what the weighting is. And so what we're trying to do is build that trust in treatment during review so that that clinician can determine and be the determiner of the confidence of the information,
right,
and not feeling the need to blindly trusted or because they read a peer-reviewed article about it. They literally are feeling empowered. And so it's approaches like this that, and of course, having the right infrastructure and approach to machine learning operations, MLOps wasn't around 10 years ago.
That's
so
right.
What are your mechanisms and best practices for bias detection, continuous bias detection, for drift alerting? These are all those sort of try to willy-nilly and cowboy their way in healthcare will fail.
Sure.
And so slow and steady, evidence-based, continuous learning and having the right infrastructure, mechanisms, the right people that know healthcare. The most dangerous element, I think, in healthcare is when you have somebody who comes from another industry and comes in and says, we're just going to do it like we built Netflix.
Right.
And healthcare couldn't be more different and shouldn't be ever compared to or looked at that way.
Absolutely. And in another life, I was a CIO for a large healthcare system, and I used to talk to vendors all the time, especially those who were non-traditional healthcare technology vendors who now wanted to get into this space. And I would always have the conversation with them around, do you know what it means to now be in healthcare? And are you willing to accept the same amount of responsibility for that individual's life as that clinician is accepting when they provide a treatment for them? If you're asking them to use your technology to treat a patient, are you going to be held accountable if that technology fails that patient to save their life? Are you going to be in that waiting room with that clinician, talking to their loved ones and telling them, oh, I'm sorry, I couldn't save their life because this piece of technology failed them? You're not ready to do that, accept that level of responsibility, then you're not ready to be in healthcare. And I think a lot of technology companies fail to recognize the repercussion of their solutions. Well, we have 5 nines of reliability. What about that 0.000000 time it does fail, and that's your mom on that operating table or taking that medication or whatever it might be? Are you prepared to accept that error rate for the people that you love? And there's why clinicians are a little bit leery about using these things, because they want to have some sort of accountability for everyone.
Yes.
And I would just make one final comment as it relates to the whole governance piece. We have to make sure our state and federal legislators are also knowledgeable about these things. So as we're passing laws that can support the governance of this type of platform, they're making that with the very informed intentions. Because the technology is outpacing the legislation that's out there as well, too. And we have to make sure that they are not burying their heads in the sand and are slow to respond to the mandates of the technology and the governance around that as well.
That's a great point.
Just final thoughts. I knew, as we went through this whole conversation, it would go really quickly. So I could have you on for another hour talking about a whole bunch of other things related to healthcare IT and AI in general. I'm just interested from your perspective, where you see the industry going and any kind of final thoughts you might have about the adoption of generative AI within healthcare.
Oh, boy. That's
I know it's a loaded question.
We could definitely be here for a few hours.
Yeah.
First, I will say is that data accessibility and transparency is a must. As we talked about at the beginning of our time together, there's no shortage of data. We have data everywhere.
Right.
What has been such a crisis, one of the many crises in healthcare, is the lack of availability and transparency generally. Transparency, then ... fill in the blanks.
Right.
And the data is the power. And so for vendors and health systems that want to basically hoard or hold on to their data are really not doing our own industry the proper justice. Because So for me, that's sort of my first soapbox is free the data.
Right.
Data, and let the US as a country, which is known for being the most innovative in the world, let all of the smartest engineers, scientists, innovators have at it to do the best and build the best tools in order to move the needle, to go after the 10x biggest pain areas in healthcare, to really solve.
Right.
And so that, coupled with then as vendors, be as responsible as possible in data security, of course, safety, patient safety always has to be your number one priority, table stakes, of course, and transparency to your algorithm so that we can build trust as fast as possible. What we need to do generally in our industry is we need to shorten that adoption curve around leveraging technology. Another crisis in our industry is clinician shortage. This is
Exactly.
an actual crisis.
Yes,
We
it
have
is.
folks in this country today that don't have enough caregivers in certain specialties. The only way the technology is a force multiplier to this problem. And so we need to, A, use it safely, correctly, and most effectively. And we need to adopt it faster so that we can get in front of some of these huge challenges. We have patient health equity is another crisis.
Yes.
And some of that can be solved or the gaps can be closed because of technology. We have 30% of the US still doesn't have access to broadband.
Right. Exactly.
What do you do if you live 30 miles away from your closest hospital
Yes.
and you are in treatment? There has to be technology that's designed for those real life situations in order to bridge those gaps. And so we have to adopt the technology. We have to spend the money on the technology. Hospital systems are in their own crisis from a financial perspective. They're not making any money.
Right.
And so they largely, every hospital executive I've spoken to in the last 6 months says the same thing. We have a moratorium on spend. And unless you can prove there's a patient safety or you can show me a 25% margin improvement.
Exactly. I'm not doing it. Right.
I can't.
That's right.
And that's a limiter as well. So we, to your point, legislation, we need support from big sort of macro lenses in order to really move the dial. So those would be my most
calls for action. Calls for action, right?
Thank you. Yes.
Yeah. Well, first of all, thank you so much for taking time out of your busy schedule to have this conversation. We've got to have you back on. There's just so much more we need to talk about as it relates to this topic and many others as well, too. And so for this episode of Straight Out of Healthcare IT, it's a wrap. I want to thank my guest, Kathy Dalton Ford, Chief Product and Strategy Officer at Ronin, for taking time out of her busy schedule to share with us her insights on this emerging field of generative AI. It's clear that generative AI is truly a game changer. It will be a game changer in our industry. We talked about a wide for different applications of it. And specifically, we talked in detail about the diagnostic accuracy and enhancing patient care and personalized treatment programs, as well as many, many other ways that this technology will have an impact on the ability to provide better care for individuals, both within the traditional healthcare setting and outside of that as well, too, as we've talked about the potential for things like virtual care technologies. The ultimate goal here is to improve the lives of everyone through the use of these technologies. So we have to make sure that our politicians, our clinicians, our business leaders fully embrace this technology, create the necessary governance and guardrails to ensure that it continues to add value, but also do not stifle the innovation necessary to continue to make sure that it does realize the potential that it has in this space. So thank you again. I'm having you back on, so be prepared to come back at a later date and we'll explore this topic in further detail and what you guys are doing at Ronin. So thank you so much, Kathy, for joining me.
Christopher, thank you for having me. It's been an absolute pleasure. I want to thank you for bringing light to this very important and emerging topic, asking very thoughtful and important questions to me and to the space and for everybody wanting to serve in it. And so I thank you for all the work that you do and for bringing this to a larger audience. These are important conversations, and I look forward to having more with you as well and your listeners.
Sounds great. Well, thank you again, everyone, for taking time out your schedule to listen in on another episode of Straight Out of Health IT. I'm your host, Christopher Kunney. It's been such a pleasure and honor to bring you this program today. Let's make this episode go viral. So please share it. If you like the insights that you gathered from this conversation, please share it with your colleagues and friends as well. And as always, your comments and feedback are always welcome. I thank you for your continued support. And see you next time on the next episode of Straight Out of Healthcare IT. Take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Kunney on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.